Are you feeling drained, exhausted, and just simply worn out? It's okay. It's easy to feel this way, especially when you have very little control of what's happening in your life. That's a reality during this pandemic. On the program today, we'll help you alleviate the pressure and ease some of this heavy burden. I'm Dr. Freddy Gomez. This is MedTalk Health Talk on CNN Philippines. There's a lot of fear and anxiety during this pandemic. It can be overwhelming, and many of us are feeling trapped. As a result, this can cause strong emotions in adults and children. But emotional exhaustion can take a toll on our minds and bodies. We'd like to welcome our guests today. We have Dr. Edmir Macabulos. He's the immediate past president of the Philippine College of Occupational Medicine. And we also have psychologist Rian Portugues. Good to have you both on the show.
Thank you very much, Doc Freddy, for inviting me in your episode of the show today. And may I say hello to all your televiewers.
Ngayon, madaling ma-stress, lalo pa ngayon. And for several months, we have been living with this pandemic. We have different emotions about it. We are worried, we are panicked sometimes. So, Rian, let's first talk about where this fear is coming from.
Thank you for that. This pandemic outbreak produces mixture of emotions to most of us, including fear. But to zoom in dun sa fear natin, the cause of fear and worry can be traced from the idea of getting the virus yourself and your loved ones. Worry of getting reinfected once you've already had COVID. Worry of losing your job, which will lead to financial issues or concerns, which will give rise to other problems such as sustaining your daily needs, paying your bills, etc., etc. So the fear that started from health concern branches out to different problems. Para siyang chain reaction. And all of this, tulad na mention yung Doc earlier, all of these are normal.
At ang takot na ito nadadala rin pati sa workplaces natin. Paano ito nakakapekto lalo na sa productivity ng mga empleyado? Dr. Edmir.
Well, obviously, even pre-COVID, we have some problems in the workplaces. But this time around, we have problems also from working from home. So aside from that, this work from home arrangement serves as a borderless boundary, so that a lot of adjustment will be there. We have reports that there is increased workload, increased work time, as well as lessening of the rest period. So we cannot distinguish right now your home task as well as your work task. And of course, there is uncertainty for those who are working, particularly the frontliners. There is uncertainty whether they're going to be infected and at the same time bringing the infection in their own homes. So basically, this is what we're having right now. Although, of course, we know for a fact that there is already a law of the telecommuting law even before the pre-COVID time. But of course, a lot of us are not used to having this kind of arrangement in the workplace.
Mm-hmm. And in this time of COVID-19, information is most helpful. Knowing what we need to do to protect ourselves and our loved ones will make a huge difference. Madalas man nating marinig, it's really worth reminding everyone time and time again. Dr. Edmir, what are your best tips or advice to everyone when it comes to personal hygiene at home and at the workplace?
We have been bombarded with the preventive and control measures as far as avoiding the spread of COVID is concerned. So we always should go back to the basics. We don't have to reinvent the wheel. We know for a fact, based on the studies and statistics, that the simple use of the mask, actually the proper usage of masks, will contribute more than 90% in preventing the spread of the disease. Physical distancing actually will also contribute the non-transmission of the said infection. And at the same time, personal hygiene is very, very important. This is very, very basic. You will be surprised that a lot of people, if you ask a lot of people, they are aware of these things. But the only problem is how or if they are really doing it in the workplaces as well as the home. And of course, the more important thing is ensure that you will be doing disinfection as much as possible, because we don't know when this COVID infection will be visiting our workplaces as well as our own home. So we have to strictly follow the guidelines for the prevention of the spread of the virus. And it's all over. It's in the social media. It's in the TV, in radio. So please let us follow it strictly. And I know for a fact that it will really help lower or reduce the spread of this disease.
It's been more than 6 months since the first person with COVID-19 was diagnosed in the Philippines. And since then, our lives have changed dramatically. Balik tayo ulit sa emotional exhaustion. What are the warning signs then when a person is going through emotional exhaustion, Rian?
Well, let's first define what is exhaustion. It's not a simple tiredness. We can actually use the term fatigue then, not to describe exhaustion. For emotional exhaustion, yung usual manifestations are poor concentration or poor focus. You are more than stressed out, lack of motivation, feelings of helplessness. And if you're working, no, there's also yung feelings of guilt when you're not performing really well, no, or hindi ka pasok dun sa expectations na sinet mo for yourself. And difficulty of regulating your emotion to situations. It seems that things are out of your control. You get mad easily, or you are irritated most of the time. There's also feelings of apathy, or you're not caring about anything. So yun yung common highlights ng exhaustion or emotional exhaustion. But it's also important to remember na people cope differently sa ganitong klase ng experiences. But these are the common manifestations lang.
But even without COVID-19, there are a host of other situations that can cause stress and anxiety. And our goal today is to find ways to identify when you need help and address the problem. More when we return. You're watching MedTalk Health Talk on CNN Philippines. The World Health Organization defines mental health as a state of well-being in which an individual realizes his or her abilities, can cope with the normal stresses of life, can work productively, and can make a contribution to his or her community. There are many factors that can affect a person's well-being, and COVID-19 is one of them. It's causing fear, panic, and emotional exhaustion. It can result in stress and eventually depression. But the WHO reported that even before the COVID-19 pandemic, the Philippines had already one of the highest rates of depression in Southeast Asia, affecting more than 3 million Filipinos. If not treated or addressed, chronic stress can cause or worsen serious health problems. What could happen to someone going through so much emotional exhaustion over a period of time? And as with any illness, symptoms may vary. Let's name some of them along with a short explanation. Rian?
Well, no one is immune to exhaustion, especially if exposed to distressing situations. So, if you are exposed to distressing situations, more likely you'll be vulnerable than others, no, na maka-encounter or makapag-develop ng mental health concerns. So, these are the following things to remember na maaaring mag-contribute doon sa vulnerability natin sa mental health concerns. Number one is stressful working environment. So usually, who are those people working in a stressful environment? We have healthcare workers, yung nurses, doctors, meron tayong teachers din. On the other, ibang nature ng industry, but stressful din siya as of this moment, lalo na sa online learning, di ba? Teachers, police, people working in a BPO industry. So those works are demanding, fast-paced, and stressful in itself. Added to that, no, if they don't like their job, merong inflexible schedule, lack of autonomy to do their job, poor job fit, long working hours or exposure to to other stressors dun sa environment nila, more likely mag-i-increase din yung possibility na makapag-develop ng mental health concern. Another thing that contributes to vulnerability is loneliness. Ayan. That's why we keep on telling other people to establish strong social and emotional support, because it's also proven ng research na when you have this strong social and emotional support, it lessens the harmful effects of burnout, exhaustion, and other mental health concern. Poor adaptive coping strategies. Ayan, another din yan. So to counter this poor adaptive coping strategy, we can also explore self-care activities. So when we say self-care activities, these are the things that you actually enjoy. These are the things that you find pleasurable. Ayan. So ito yung specific activities that helps you lessen yung distress, yung burnout, yung exhaustion. And another thing that can contribute dun sa vulnerability ng mental health concern natin is yung unhealthy lifestyle. So such as yung lack of healthy diet, workout, yung sleep, etc. And added to that, syempre, more likely, makakapag-develop ng mental health concern din kung you are already predisposed to particular disorder. Tapos, nag-exacerbate na lang siya because of our condition, such as nitong pandemic outbreak.
That's right. So marami talagang factors ang involved with
Yes.
emotional exhaustion that can easily pull someone in there. Now, there are people who are most vulnerable to emotional exhaustion, especially during this time. So we can especially look after them and anticipate how we can help. Dr. Edmir, sino-sino ang mga prone sa emotional exhaustion?
Well, in our current situation, the frontline workers, those that involved in production of essential goods, in delivery and transportation, or those who are responsible in ensuring the security and safety of the population. These people are facing many stressful situations at work as a result of the COVID-19 pandemic, while trying to cope up with additional challenges like encountering unfamiliar working environments, changing protocols, and an unprecedented exposure to physical, psychological trauma with little opportunity for orientation and training at the outset. The high risk of work-related stress and burnout is a result of the increasing demands and diminution of staffing levels, as well as other resources. We know, in spite of the low salary for some healthcare professionals, they continue to work because they know their duties and carry out their tasks for the love of the people they vowed. And unfortunately, some healthcare professionals are even discriminated or stigmatized because people will think or are thinking that they will bring the infection to their own community. This is very, very difficult when in fact, we need healthcare professionals in order to combat this dreaded disease.
Now, experts will say the best way to handle stress is to eliminate what's causing it. But it's never easy, especially during this pandemic. After the break, we have some answers for you, steps that you can take to help. In the meantime, we want to show you on our screen crisis hotline numbers you can call if you need help. You're watching CNN Philippines. Hi everyone and welcome back to Med Talk Health Talk. The COVID-19 pandemic is still affecting many of us. And during these very challenging times, effective intervention is what we want to focus on. Today, let's start with some physical activities we can do to help reduce stress. Umpisahan natin sa breathing, which can help promote relaxation. Now, Dr. Edmir, how does it work? How can breathing promote relaxation?
Well, to begin with, having extra oxygen in our body does wonders for the body and the mind. It cleanses, opens, and soothes different parts of our being. So basically, it decreases stress, it increases calm. So when you take deep breaths, your heart rate slows down, resulting into more oxygen entering into your bloodstream and ultimately communicates with the brain to relax. So deep breathing also ups your endorphins, which happens to be the feel good chemical in our body. Deep breathing might be something that we are not accustomed to. So we just have to learn this new skill. So it's very, very important that this simple uh, exercise will be able to contribute wonders in our body.
And as we all know, exercise is also a good go-to step to manage stress. So let's get those bodies moving. We want to explain this time the physiological effects of living an active life. Dr. Edmir, how can this promote an active lifestyle? How can this promote good health?
Uh, Exercise or physical activity, it benefits every aspect of your body, from your bones to your muscles to your organs. Regular exercise strengthens your muscles and bones, which aids from common aches and pains such as the lower back pain and arthritis, as well as fighting osteoporosis and muscle loss. It also improves your balance and flexibility, making everyday activities easier and supporting your physical independence as you age. It even helps you with things you might not think about, such as relief for the women. There are reports that it helps relieve menstrual pains. In combination with balanced diet, regular physical activity is excellent from controlling your weight. There are reports that a lot of people gained weight during the pandemic. So it's important that you do physical activity, increase physical activity. Any level of exercise you do burns calories, which is essential for maintaining a healthy weight and body mass index.
Napakaraming benefits talaga in having a active lifestyle. Huwag lang biglain, of course. It's good to consult your doctor first before engaging in physical activities you have not done before. Baby steps at first is good. Walk before you run. In short, pace yourself. Now, Rian, meron din bang mga mind exercises that can help manage stress?
Well, to manage yung stress natin, for usually kasi for psychological din, I think kasi na-mention na halos lahat ni doctor kanina yung effect din sa mental health ng physical natin na exercise eh. Yung mga sa mental naman, actually pwede natin i-try yung mga activities such as yung nag-challenge nung ating cognitive ability, pwedeng sudoku, pwedeng puzzle games, etc. Anything na pwedeng stimulate ng mind mo. Kasi nga iba-iba tayo ng interest when it comes to self-care activities o kaya naman ng mga challenging activities. And it's something na you need to explore, no, sa sarili mo. Pero when it comes to reducing yung feeling of stress, no, to add to that, no, I think yung talking can actually help you reduce yung feeling of stress. Kasi for us, no, meron kasing interesting study sa psychology, yung kay Townsend and colleagues noong 2013, na-mention niya na yung similar emotions or yung emotional similarity can actually help a person to feel calm. And moreover, when we are actually talking out our problems to someone we trust, it helps us to get out yung problems natin to our system, which gives us a sense of relief. And at the same time, somehow, when we try to share our problems to someone we trust, no, it also makes us feel safe and loved and important, which also helps us facilitates maka-experience ng acceptance na helpful sa healing process natin.
Our mind and bodies need a break, especially when going through a lot of pressure or when you're under a lot of stress. And that's where good quality sleep comes in. Now, Dr. Edmir, how much sleep do we actually need?
Well, for adults, we need between 7 to 9 hours of sleep in every 24-hour period. Although it will vary for children and adolescents, but the more important thing now is those who have been having some stress and sleepless nights are the adults. So ideally, it's between 7 and 9 hours. Lack of sleep will also be detrimental as far as our body is concerned. In fact, there are some studies that sleeping for 5 hours or less per night routinely is associated with increased risk of heart disease.
That's right. Aside from getting some good quality sleep, you should be able to talk to someone as well. And we'd like to thank our guests for today, occupational medicine specialist Dr. Edmir Macabulos and psychologist Rian Portugues. Marami pong salamat sa inyong dalawa. It's been a real pleasure speaking with both of you.
Thank you very much, Dr. Freddy.
Thank you.
Now, the difficult situation we are in right now isn't going away anytime soon. That's the sad reality. But we have responsibility to each other. Sabi nga nila, mahirap man, we are in this together. Thank you for watching MedTalk Health Talk. I'm Dr. Freddy Gomez. Stay safe, everyone.